Well, lovely talking to Katie, but Katie's now been joined in the studio by Councillor Sean Fielding. Sean, good morning.
Good morning. Good morning.
Now, tell us a little bit about yourself. You're a councillor. Which ward are you in?
So I'm a Labour councillor for Brakemet, which is out to the east towards Bury. I've been a councillor since May 2023. I was elected in the all-out elections, and I'm going to be here until at least 2027. And then, of course, it's up to the voters whether I get to keep my job or not.
Right. And do you enjoy this job? Obviously, you do it, but does it bring you joy or is it challenging?
It's incredibly rewarding. It can be challenging, but it's something that's rewarding because, you know, I support lots of people in Brakemet with some really, really complex problems, housing, benefits, problems accessing all sorts of public services and acting as an advocate for them. And when you get results, when you find someone a new home or when you help them make a benefit claim that they are entitled to, but they'd be really struggling with the forms to do or something like that, as an example, it is rewarding because it does improve their lives and you get to see the outcome of that.
Right. Now, your portfolio is adult health and well-being. We have discussed before on this programme, I once went to see the head of the clinical commissioning group, and on the wall he had this big map of Bolton, and there were different shades for different parts of Bolton, and Brakemet was one of those areas where health and life expectancy was much lower than it was in leafy Lostock or Heaton or places like that. So there is a huge disparity between where people live and what they can afford and how well they eat and things like that. How do you face up to that?
Well, that's right. And there's a really interesting piece of work that was done where they mapped life expectancy on the 501 bus route, which runs from Falmouth in the south up to Johnson Fold in the north, and along just a few minutes down the road on the bus, people's life expectancy could vary by 2-3 years. So people were living longer in more affluent parts of Bolton that it goes through and less in poorer parts of Bolton. And I don't think I'd be speaking out of turn if I said that many parts of Brakemet are sadly quite deprived. And people there are lots of people that don't have a lot. They don't have great standards of housing. Sometimes they struggle accessing work. And I was at a presentation yesterday where actually we know that if you sort people's housing out, you get them a job, and they have friends and a support network around them, then often the other things like health and well-being can sort itself out. Yeah. So while we can make sure that there are enough doctor's appointments, we can make sure that people aren't waiting really long for operations at the hospital as best we can, actually it's lots of those social factors that we need to sort out really by providing good quality housing and making sure that everybody's got access to good, well-paid employment.
Right. Do you have in your responsibility more need from older people rather than younger people?
Yes, and here in Bolton we have an ageing population as well, which is the same across the whole of the country now. You know that my mum and dad were both one of four. I'm an only child, and my mum and dad's brothers and sisters haven't had 4 children. None of them have. So each generation is shrinking. So it means that the age profile of both Bolton and the country is skewed towards older people. So we are seeing more pressure on health services as a result of that ageing population. But again, we need to think about other ways that we tackle that. And one example is to provide specialist housing for older people. And I was at Lever Gardens Court, which is a new facility only last week, which has opened in Little Lever, which is a special development of apartments for older people, set at more affordable levels of rent or to purchase. And people can move in there when they reach an age where they might be struggling with a larger property, or they might be isolated and want to be part of a bigger community. They can move in there, move out of a larger property, which frees it up. And also by just being around other people the same age with the same interests, having that social network that can support them, and they in turn need to access health services much less, and that improves the situation for everybody.
Whereabouts is Lever Garden in Lever?
In Little Lever, so I can't remember the name of the street, but it's very close to Tesco in Little Lever for people that are familiar with that.
Okay, so that's handy. Yeah,
and it's a partnership with the council, Bolton Cares, and Bolton at Home. Bolton at Home being the provider there of the housing, and that's the first one of its kind in Bolton, provided at that tenure, where it's more affordable than other private providers that you may have heard of, like McCarthy Stone, who of course have a place in Harwood. But it's the first of its kind, and it's intended that there will be others as well, because we need to provide housing, specialist housing for older people that we're seeing more of.
How many units are there? Do you remember?
I think it's 62.
Oh wow! So it's a big deal then.
Yeah. So I went first when it was empty, before people had moved in, to go and have a look round and see what it was like. And when I went last week, it's full now. And even in that short time, it was about 2 months between the two visits, the community that's built up between the people that live there is really, really strong already. So people are playing games, people are arranging to go out together. And one of the added benefits for people in Little Lever as well is that there's a bistro and a restaurant on site, which is accessible to the public.
Sounds good.
So if you live there, you can call in for a coffee or something to eat.
Okay. For the moment, let's have a break from the small faces. We're talking to Sean Fielding, who's the man in charge of adult health and well-being. And it begs the question, as a politician, why do we need a politician to look after Bolton at Home, the Carers Association, residential homes, health? Nick Peel, the leader of the council, last week was saying that social care is the biggest cost for the council. It costs millions.
Yeah, well, that's right, and it's a fair question, but the simple answer is accountability to begin with. I live in Bolton. Many of the senior people that are employed to run services like Bolton Council or Bolton at Home, Bolton Cares, don't have to live here, so they're not drawn from the community that they're serving, and it's important that we have people that live in the communities so they're familiar with it and they can advocate on behalf of their friends and neighbours. So that's why I'm there. But it's absolutely a fair challenge that I don't have a background in adult social care, I don't have a background in social work or anything like that. So why am I there? And the answer really is that I elected on a platform to put my values into everything that we do in the council and in my particular area in adult social care. So what that means is that I'm keen that carers are paid fairly, which is not the case in lots of places. And so when I'm letting contracts or signing off or approving decisions, my question is always, are we building in payment of the genuine foundation living wage so that carers are paid fairly? Because there are many places that pay the minimum wage or the bogus national minimum wage, which isn't enough to live on, as has been calculated. And again, because I'm a Labour councillor, I'm always asking, are we putting trade union recognition agreements into all the contracts that we let as well? Because that's really important to me, that workers have a voice. And finally, on people that are receiving care that's provided for or on behalf of Bolton Council, are we making sure that the standards are such that everybody is treated with dignity? And I can draw from my experience of interacting with people in the community and dealing with individual casework as a local councillor on what that means to make sure that people are treated with dignity. And sadly, sometimes people come through to me where there have been some really bad examples. And so I can take that experience and that learning to our officers at the council and say we need to account for this when we're letting contracts. You're right too as well that it's a massive challenge financially to provide the resource that we need to service the ageing population and make sure they get the care that they need. And I'm hopeful after a change of government that they'll look a bit more favourably upon us than we have been for the last 14 years. But I think that we will still need to continue to campaign. And even though I wear a red rosette like the people that are now running Westminster, it doesn't mean that I won't be challenging and being difficult and causing problems where I need to make sure that Bolton gets its fair share from London.
Right. That sounds... And if during your tenure as the what are you, executive member?
Executive cabinet member for adults, health and wellbeing. It's a mouthful.
It's a mouthful. It's a good one. But do you have any aims and objectives that you want to achieve in your tenure?
Well, we talked before about the disparity in life expectancy in Bolton, and I think that's something that I'd certainly like to see reduce. Not because I want people that are living longer to live less. We want the people that are living less to live longer, so that gap between the richest and poorest in terms of their life expectancy is reduced. We also want to start reinvesting more in preventative services, whether that's helping people that have drug or alcohol problems or any form of addiction or anything that ultimately causes them a problem such that they become really expensive to deal with when it's gone so far further down the line. And we need to get in there early, and that's something that's been a real casualty of the cuts over the years. And I hope that we can support people with those early interventions more as we're given more money, hopefully, by the new government.
That sounds good. And who is your director in the officers level? Do you work with Bolton Health?
So we've got a few. So Rachel Tanner is the Director of Adults and Housing, or that was the title last time I checked, but sometimes they get updated. So I work very closely with Rachel in the council. Ling Donkin is the Director of Public Health.
We know Lynn really well because during COVID, we were interviewing her every week,
right.
And we were kind of broadcasting. Bolton FM managed to broadcast throughout COVID, and we were doing it from our front rooms. So Phil would be in his house, I'd be in my house, Lynn would be in her house, and we were doing fantastic conversations and giving people updates on what they could and couldn't do and how to be preventive and gels and masks and it's amazing. And you think back what we went through for those 2 years, I think it was.
Yeah.
Wasn't it?
Well, there are elements of that I missed. Like I used to be able to work in my pajamas and things, but I can't do that anymore. I've had to put a shirt on to come and see you today.
It's a bit casual. You look like you're on your holiday show. You really do. You should be in Mallorca dressed like that. But it's good to see that you are. I mean, wearing a suit in Brakemet would you look like the accused, wouldn't you? I mean, so good to see you, and it's good to know that you're working on behalf of the people. It sounds like, Katie, you're an outsider looking in on this. What do you think?
I think it's extremely interesting. It's kind of a side of things that I haven't really thought about, but the conversation is so important to be had. And as someone that now lives in Bolton, it's such an important thing to consider. Really, really interesting.
Good. And what else have we got lined up for this next couple of weeks, Sean, for you?
Well, there's plenty of stuff that's not just adults' health and wellbeing and happening over the next few weeks. We've got the food festival coming to town very soon.
Yeah.
I'm not originally from Bolton. The first time that my girlfriend and I visited here before we moved here was the weekend that the food festival was on.
Oh, very impressive.
It was impressive. I thought, blimey, it's so busy in town. And it was hammered, and there was loads of things going on. What else?
Did you say you got hammered?
No, later on. Yeah, town was hammered. And right. And it's fantastic that we've seen the benefit that delivers to businesses. I did the Ironman. I didn't do the full Ironman. Sorry, that's dishonest. I was part of a relay that did the Ironman the other week, which again is a fantastic event that brings loads of people into Bolton. I only did the swim, which meant I had to be at Pennington Flash at 6 a.m. on Sunday.
No! Well, that is the most difficult part of it for me.
But it meant I could go back to bed, which I didn't go back to bed. I stayed up, but I was a bit bog-eyed by the time we came to get the medals as a team later in the day. But yeah, there's loads of exciting stuff in Bolton. I think that as somebody that's relatively new to the town, I've been here about 2 years now.
Where are you from originally?
Oldham.
Oh, right.
So not far.
Not far.
But I do think that we undersell ourselves sometimes, and we don't always realise what we've got.
That's right. Well done. Well, thanks for coming on this morning. It's been when are you due in again? Is it about?
Well, there's 8 of us, so if you do a different one each week, then I guess I'm back in 2 months.
2 months' time. Well, we'll look forward to seeing you. Sean Fielding, thanks for being on Bolton FM this morning.